Okay, I'm on my way to the doctor's, as I said earlier. My appointment's at 2:15. I think it's like around 2:05 maybe at the most. I'm really sick. I don't really feel like going to this appointment. I should be in bed. My head hurts. It hurts to even look at people. Like everything, my eyes, my head, my cheeks, my jaw, everything hurts. My throat hurts. I'm stuffy, been coughing all night, feeling weak. But maybe it's kind of good that I'm going to the doctor because they can probably check me for that, which is going to just probably be a normal cold/flu thing. But I'm actually going to have my eye checked. I was telling you guys I've had a lot of pain, like this whole area here. It's hard for me to even touch my eye, like even just touching it like this or doing makeup. It feels like I have a black eye, but obviously I don't. And I'm also having them check my arm because my arm's been really, really in pain a lot lately. And it's been hard to sleep. I can't sleep on that side, but I get tired and numb on this side, so I sacrifice. I've been trying to rest it, but of course, it's almost impossible when you like your house clean. You have to brush your hair and you have to take a shower. You need your arms, so I've tried icing it. I take an ibuprofen at night. I think I tried heat. I really need to get me a heating pad. But hopefully she can kind of give me an idea of what she thinks is going on with my arm. And my daughter's with me. So that's it. After that, I'm going to go to Walmart. I have to exchange some pants that I was saying that my son got from my husband. And since he's picky, I let him see it, and good enough, because he said he doesn't like those. They're not a good fit for him, and that's something in the seam, and then they're too long, and he showed me they were dragging on the floor. So I'm going to exchange them for something else, and then it'll be perfect because he'll be surprised. God, it even hurts to talk. So I'm hoping I make it in time, because last time I was a little bit late and they wouldn't see me, and I'm like, I really need it to be seen. And it makes me mad because sometimes they're late and I still don't complain, but I'm not trying to be late or give them any excuses. So when we get there, I'll let you know how it goes. Well, we're in the doctor's office waiting to be seen. My appointment was at 2:15. It is like 2:55. Not good. But I heard she's really nice, and so hopefully we can figure out what's going on with my eye, with my arm, with the sickness. We've been even doing some math. But I'm not feeling good. I wish I didn't have to wait this long, which I normally don't wait this long. I don't know what's going on. But yeah, we'll see what's happening. She should be coming in any time. Like I said, my appointment was at 2:15. Then the nurse sees you and gets as much information as they can. And then she leaves, and then they usually come in within 10 minutes, but it's been a long time. So because I'm not feeling good, I'm really wanting just to be seen. So we'll let you know how it goes. So I just came from the doctor, and her recommendation was I needed to go to the ER because, for one, they don't have the equipment to really check my eye, and she's feeling like it may be a glaucoma thing, which unfortunately my dad did have glaucoma, and it's hereditary, and so every year I'm supposed to be checked for it. So that really scared the heck out of me. Or it could be what she said,
something with the inflammation of the arteries.
Yeah, inflammation of the arteries. My other doctor thought it was something in the nerves, but she said I wouldn't tell you to go if I didn't think it was necessary. I'm letting them know you're on your way there, and they really need to check it because it's nothing to mess with. And I knew it was serious, and so I was afraid. Eyesight is nothing to play with, and because my dad does have glaucoma, and because I do have a brain nerve disorder, it's just not good. So I'm just praying that it's not glaucoma and it's something that, like she said, that they can, if it's inflammation of the arteries or the nerves, they can put you on steroids, hoping it's something like that and not glaucoma, because there's no cure for glaucoma, and eventually you end up blind, and that's not the way I want to end my life. So we got to go get our charges, because we don't want to be in the, sometimes you're in the ER for hours at a time, and her phone is dying, and you never want to be without your phone charged, because in case I have to keep in touch with my husband or something happens, you know, my phone is pretty charged, but like I said, you're always in there for hours. So we're gonna pick that up really quick and then we'll head off to the ER, and then when we get there, I'll try to keep tabs on the latest update.
I'm sorry. So, does that hurt the eye, your left eye?
When it goes over it a little bit.
It does hurt your left eye a little bit? Okay.
So just because of the light?
Maybe more related to a cold than anything else.
Well, I had this before I had the cold. I just got the cold like yesterday or the day before. I could feel something coming on. Like, oh no.
Oh God, this still throws me off. I'm sorry.
Here, you find a place for that one.
What about in the, you know, somebody filled up a whole drawer of nerves.
It's like,
Isn't
nope.
that weird?
Yeah. I did that at the very beginning.
So both eyes are normal.
Okay.
Okay, good. So,
Give it a minute to focus. Stay there.
Let's see. Well, we're
Hi.
almost done here. They did a few tests on my eyes. I don't have glaucoma. Yay. Don't have, what is the inflammation of the arteries or something? He's thinking it could
Arteritis?
be arteritis. Yeah,
I
he's
think-
thinking it can be from the sinuses, even though it happened way before I got sick. But it probably knew I was getting sick, or something was already kind of happening, and then it just worked its way up to a full-blown cold/flu, whatever.
You're
that I
getting
have
you're
now.
getting one of those
So,
sicknesses in the winter. pretty
But
much.
he has recommended me to go to the ophthalmologist to, seek further stuff, because they could do other tests that they don't do here. So I'm gonna set that up for me. So, yep, this is my room.
Hi.
It's my dog.
I ran around.
So it was this cool machine that he did that like shoots at you and it makes you blink. It's
it
really
looks
cool.
like the shape of an F, like this. You know how there's like two lines
Yeah.
and one line? There's like the top one has this little pellet thing that sticks to the top of your head, and then there's one right here that goes boop, 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 like, shoots
What
really
was that for
fast.
the pressure?
It was to, like, when it shoots out, it's supposed to see how fast
Oh,
it
and-
bounces back, because it shows, like, the faster, high pressure, the slower, low pressure on the eyeball.
Okay, yeah.
Yeah.
Mine was going fast.
Yeah.
It looked like it was going a mile a minute. So all good, except I still need to see ophthalmologist, which I'm due for to be checked, because like I said, my dad has glaucoma, and even though I don't have it, I should be checked every year. And then I think my glasses are not at where it should be.
I think it's
I need
straining
to.
your eyes.
Yeah, so because they're not at the proper vision that they should be, I think I need to be checked so that he can give me the right glasses, because I think my vision has gotten worse since the last time I did see an ophthalmologist. So it's all for the better good. I need to check a lot. So I'm doing all my preventative care. So that's just maybe something that I hadn't
Yeah.
thought about, and that my body was telling me, okay, since you're not thinking about it and doing it, we're going to shut it down so you can think about it. I hate that I had to come to the emergency room to find this out, but I'd rather have it checked and then can go home and feel at peace
Don't
that
worry.
everything's good. Don't worry. Yeah. So I'm just waiting for him to come back with, because he was supposed to call the ophthalmologist and get some things done. And so I'm just waiting for him to come back to discharge me. And then we'll let you know when I get home how it all goes down. Did you guys see my daughter's look for today?
Look at it's Christmas lights. They're not glowing,
She's
but I
so
wish they could.
talented. Close your eyes so they can see how it looks. Yes, she is so talented.
And then I have this weird, stupid
One
line
day I'm going to
crease.
do a video of all her looks.
Okay.
Like a slideshow.
Here's the
so you
thing.
guys can see how talented she
Here's the
is.
thing. People don't know why I used to just do the one dot, and now I have two because Jacob thought it looked not symmetrical for some reason.
That's funny.
He's like, this should be another dot on the other side. No, but you know, like Marilyn Monroe has one dot, right?
Yeah.
I think above her lip, whatever
Cindy
side this
Crawford,
shows.
too.
So I have a birthmark right there. That's why I color it in, so I accentuate it. You know, love it. And then, what is it? My boyfriend told me, oh, why is it not on the other side? Because it looked like I wiped it off. I'm like, no, I just don't put it on the other side because I don't have a birthmark there.
I think it
And
looks
he's like,
better either
you should
way.
put it on the other side. I'm like, you don't tell Marilyn Monroe to put two like dots on her face because
That
it look
one.
like snake bites.
I don't think it would look cute.
Oh, no,
Cindy
snake
Crawford
bites.
has
Snake
one.
bites are where? Is it up here or down here?
I don't know.
I can't remember. They're piercings. That's what
I
they're.
look horrible because I have no makeup on, but I want it to be comfortable. I don't want to add any stress or strain or pressure, especially being sick
Hi.
and feeling cloggy and my face hurting, my eyes hurt, my cheeks hurt, my jaw hurts, my teeth are hurting, my throat's hurting. So I just wanted to take a shower and just be my normal self. I'm dressed
You
kind
know-
of cute
you know
though.
what we
I
need?
have my t-shirt.
We need like a good.
This used to say Paris.
It used to say Paris and all the
In gold
letters fell
letters
off.
and washing it, all the letters fell off. But I have my favorite comfy leggings. These are my favorite ones of all.
Look at her shoes.
My
My
slip-ons with my bling bling.
Your bling bling dingling. I said
Oh my
tingling.
god! Don't listen to her.
Wait.
And then we're just dressed comfy. We're not.
See,
we're
and
supposed
then
to go to
we
Walmart
We
and
got the
exchange
rose gold
some stuff.
color going on. Look at this. Not the
Yeah.
same color, but still. Oh my god, Bullock.
So yeah, I'm gonna get off of this thing because it's hurting my hand to hold it. But we'll
Yep.
update you on our next move. Bye. I'm in the eye doctor, eye specialist office. Getting follow up on getting my eyes checked. So here we are. My eyes have been dilated. Let's see what they say. So hi everyone, I'm trying to end this blog that I started yesterday. So this will probably be the last part of it. I'm trying to do Blogcember, which Chabella came up with, but a lot of YouTubers call it Blogmas, which some people, Blogmas? Like blogging for Christmas time, something like that. I guess that's where it came from. I tried it before and it just didn't work out because sometimes videos wouldn't upload for a couple of days and it just was a lot of things happening, so it would never really work out. But I really want to do it this year. So I do it like Chabella, December 1st through the end. And some people started November 25th through December 25th to the day of Christmas. So I'm hoping and praying that I actually could do it every day and that it works out. If it doesn't, at least I'll try to get 2 in one day to make up for the one day that I couldn't get it to upload or for whatever reason I couldn't do it. So wish me luck on that. But yesterday I started blogging. As you can see from what I said earlier, I had went to not my primary doctor because I don't see him to the 10th. He's booked to the 10th. So I had to see somebody else in the same office about my eye pain and my shoulder pain. My shoulder's been throbbing. It's been off the chart. Just standing or sitting, it hurts. Sleeping is the worst. So I can't really sleep on that side, but I get numb and tired from this side. So I have to sacrifice, and lifting it, going forward, any movement with it, it's just been awfully, awfully painful. And also my eye pain, I needed to know what was going on with my eye. And so, as you saw in the video, I had went to the doctor, and then she thought it was serious, and it was serious enough to get me to the emergency room to have somebody look at it. You don't mess with your eyes. I don't blame her. The ophthalmologist, I think they are, the eye doctor, The nurse was saying she should have just sent you directly to us because we're the specialists instead of sending you to the ER. I said, yeah, that kind of makes sense, but the same thing they did there, they did in the ER, except a little bit more extensive, of course, because they do have extra special machines, which the doctor at the emergency room, that's why he told me to follow up with the ophthalmologist, because he did 2 big time testings with 2 different machines. But of course, they do have extras, and they are the specialists of the eye. So he wanted to make sure that I was completely checked out and examined every way possible to rule everything out. So I appreciate that for him. But she was like, she should have just sent you directly to us. And I'm like, yeah, that kind of makes sense. But maybe she was thinking that you couldn't see me right away like that. That if you could get me in, it would be a couple of days or a week or whatever, depending on how booked you guys were, because you've never seen me before. So maybe she was thinking that was too hard to do, or almost would be impossible. So the ER was a guarantee for somebody to see me right away. So I can understand that too. So anyway, I woke up this morning and I did what they told me, to call the doctor to get in within the next day or two. And so I called this morning at about 9:15, and they said, come in right now. I'm like, right now? Because I was still in bed in my pajamas. And she said, yeah, because he's leaving at 11. And I believe she said he wouldn't be here for the rest of the week or so. So I said, oh, okay, well, let me get dressed and I'll be there as soon as possible. So, of course, I have to take a shower morning and night, and especially when I'm going to a doctor, even though they're not checking me all over the body. But I just like to be clean and fresh. So I took a quick shower, got on some comfy clothes, just my hooded sweatshirt and some leggings and my slip-ons. I didn't do any makeup because I knew they were going to examine my eye, and I didn't want any makeup in my eye by accident or adding extra pressure or strain. So I haven't been trying to wear makeup these last couple of days. Plus, I'm sick. So when you have sore throat and coughing and sneezing and you're not feeling good and your face is hurting, the last thing you want to do is put some makeup on. And then with the eye pain, I didn't want any added stress or strain or anything accidentally going in the eye to make it worse. So for all those reasons, I was trying to just give my face, my eyes, a rest from makeup. So, yeah, my hair, this is how I sleep at night. I wash my hair at night, and I just put some leave-in conditioner, and this is my natural curl. And I woke up and all I did was neaten, just put some water to refreshen my hair so it didn't look so dry, and I redid my clip. And I went out. Then I couldn't find my keys. I forgot that I gave my daughter the Yukon keys because the red car didn't have any gas and she had to hurry up and get to class. I said, just take the Yukon. And I never got the key back from her. Luckily, my husband has some spares. So I grabbed the spare and I said, oh my God. So I went there and they did. They did the same machines that they did at the emergency room, plus a few other things. They dilated my eyes. They did a bunch of other exams on different machines and stuff like that. And the good news, I got good news. Oh my God is on my side. I appreciate you, Lord. You are so good to me. I feel so blessed. And I get all scared and worked up and it all ends up good. Knock on wood and thank my dear God. But he said, your eyes are perfectly healthy. You have no diseases whatsoever. You don't have glaucoma, which is something that I always have to have checked at least once a year. I should have checked because my dad had glaucoma really bad. He died from cancer before he can be blind, before he can go totally blind, because that would have been the ultimate thing. But he really suffered from it, and it's hereditary. So because I'm at a higher risk whenever I go see the eye doctor, which should be once a year, that's definitely something they have to check into. So because I had that family thing, they checked for that. He says, you have no glaucoma whatsoever. You have no pressure in the eye. You have no inflammation of the arteries of the eye. Nothing wrong with the nerves or the muscles. Your eyes are really perfectly healthy. And I said, thank God. That's the news I want to hear. But I'm glad I checked it out because something obviously caused that pain to happen. It just didn't come out of nowhere. You know, I'm not hysterical. And he goes, no, absolutely. You should. Something like that happens out of the blue. I said, because this started 2 weeks ago and I wasn't sick 2 weeks ago. It just happened. And so, and then I was having those sharp pains in my left head, which comes from my brain nerve disorder. But those went away pretty much fast. And it was just the pain in the eye. And so, What was I at? So, yeah, so he said, so no infections, no inflammation, no diseases. Your eyes are perfectly healthy. Your vision on your right is actually 20/20, even though I struggled a little bit to see, but it could be because I didn't have my glasses on. But he said your eye without your glasses is 20/20, even though you feel you may have struggled. But I definitely struggled in the left. Definitely. And he said, and your vision is not perfect in your left. That's the point of why you wear glasses. And maybe you need to, it's been 3 years since you've gone. And like you said, you always used to go once a year and you should go once a year. So it's definitely time for you to go back and get checked. And probably your lens needs to be upgraded, especially in the left, because you have 20/20 in the right. He said, so it's probably time for a new prescription, new lens to better help your eyes to see better, whether it's driving at night or just seeing anything far away. So I definitely got to do that. I don't have eye insurance. I have great medical insurance. Amazing. Perfect, pretty much. I don't have dental insurance. We have care credit for emergencies, which is used for dental, and it can be used for animals and stuff like that. If there's like an emergency, like we have a toothache and the tooth has to be pulled out, it's infected or whatever, thank God. But I need to look into a plan, because you can buy a plan. My daughter has one where I think she pays $17 a month for her, and you get so many cleanings a year. They cover tooth extractions. They don't cover things like braces or anything like that, but hey, just the basic care. And I do need it because I have periodontitis, which is a gum disease, and there's no cure. And I'm supposed to have good cleanings every 3 months. I mean, I brush my teeth like a madman, and I really have tried to take care of my teeth on my own, but I need to be checked. And so, yeah. So I definitely got to do that. I got to look into a plan that, you know, that we can get on, that you don't pay that much a month, but you can get a lot of good basic stuff for dental and vision. So I'm gonna look into that. And what else? So that was great news that I was perfectly healthy in my eyes. Your eyes are precious. They're precious. They're probably the best gift from God in your personal self. And so I was happy to hear that. So now I just gotta rest and take care of this cold sinus. Oh, so he was saying that it's actually coming from sinuses. He said sometimes your body knows when it's getting sick. And even though you're like, I feel fine, but it might start in an eye, it might start in the nose, it might start in the throat. All of it's connected. So yours started in your left eye. It started the sinus in that eye. And then the days it was draining or, you know, just really bad. And then there you went. 2 weeks later, now you have the sore throat and the coughing, the sneezing and all that stuff. So all of it's connected. So that's where that pain is coming from. Definitely, if it happens again, get checked out. Don't say, oh, I don't want them to feel like they already told me what the causes is. No, you should never mess with your health. So if you're in any doubt or it happens again or gets worse or whatever, definitely come back and get checked out. But that's what it's coming from. And the emergency room doctor told me the same thing after he did his test. But he still wanted me to follow up with the specialist, and I'm glad I did. So that's what it is. So now I just need to rest, continue eating healthy like I have been, keep a lot of water and juice to keep from getting dehydrated, and just resting and getting myself back to health, especially because my daughter's birthday is on the 16th. I don't want to be sick by then, and I definitely don't want to be sick through the holidays. These are my favorite holidays, and I want to be able to go full force and enjoy them. So that's where this blog started yesterday, and that is the end result of happened. My arm is, let me show you what my arm is. So what they gave me, I'll tell you what the arm is. So this is what they said I had. I'll do a picture of it too. And it pretty much says the sinuses are air-filled spaces within the bones of the face. They connect to the inside of the nose. Sinusitis is an inflammation of the tissue lining the sinus cavity. Sinus inflammation can occur during a cold or hay fever, allergies, pollens, and other particles in the air. Cause symptoms of sinus congestion, fullness, and perhaps low-grade fever. An infection is usually present when there is also facial pain or headache, green or yellow drainage from the nose or in the back of the throat, postnatal drip. Antibiotics are often prescribed to treat this condition. Sinus headache may cause pain in different places. Depending on which sinuses are infected, they may be pain in the temples, forehead, top of the head, behind or around the eye, across the cheekbone, or into the upper teeth. And yesterday I was saying that it started in that eye. That's where it all started, in the eye. And then it was to my temples. I was feeling like a stabbing in my temples. And then it went to this can breathe, clogging stuffiness. And then my face started hurting, my whole face here. My cheekbones hurt it, my jaw hurt it, my teeth were starting to hurt. I'm like, oh my God, I'm really sick. So this is perfectly describing me. You may find that changing your position, sitting upright, laying down, will bring some relief. And so they just say drink plenty of water, hot tea, and other liquids to stay well hydrated. This thins the mucus and helps your sinuses drain. Apply heat to the painful areas of the face. Use a towel soaked in hot water or stand in the shower with the hot spray on your face. This is a good way to inhale warm water. And he gave me an Afrin nasal spray to do. 2 sprays in each nostril twice a day. And it goes on. But for my arm, he checked out my arm. And he said, I have, these pages are so freaking hard to turn, no matter how much I lick my fingers. Oh my God, it is, I don't know what kind of paper this is. It's driving me insane. So I'm trying to get to that page. Oh my, you will not believe. Where is it? Where is it? Where is it? I'm skipping it, I guess. Okay, this is my arm situation. Frozen shoulder, see shoulder and all that stuff. Frozen shoulder adhesive capsulitis. You can see that right there. That's what's wrong with my shoulders. Frozen shoulders, when pain and stiffness make it difficult to move your shoulder normally. This condition is also called adhesive capsulitis. The shoulder is a ball and socket joint. The ball on the upper arm bone fits into a socket on the shoulder blade. The joint is covered by strong connective tissue called the shoulder capsule. If the shoulder capsule becomes inflamed and swollen, movement is painful. Bands of scar tissues from on the joint surface. This limits your shoulder's range of motion. In most cases, only one shoulder at a time is affected. Some shoulder may get frozen shoulder and the other shoulder at a later time. Frozen shoulder develops slowly in 3 stages. Each stage can last a few months or longer. The first stage is painful stage. Pain occurs when raising your arm up or to the side, exactly, or when reaching behind your back. Your range of motion decreases. The pain may be worse at night, yes, and keep you from sleeping, yes. Second stage is frozen stage. Shoulder may be less painful, but it is stiffer. Range of motion is limited. Third stage is thawing stage. Range of motion starts to improve with treatment. Experts don't know what causes frozen shoulder. It may occur after an injury, such as a fracture, or it may happen if the shoulder is immobile for a long time, such as after surgery. It may also be autoimmune response, which arthritis is an autoimmune disease. It could be all from the arthritis. But years ago in 2007, I had this shoulder operated on, and I was supposed to have this one done, but the insurance, it was a workers' comp case, didn't approve this one. So it was just left like that. So it could be coming from leaving it like that and then years of overworking it. It actually happened from being a hairstylist. I was working 15, 20-hour days, cut after cut after cut after cut. We were in a salon that didn't do appointments. It was first come, first serve. You just sign up. You didn't make an appointment. So I was cutting hair every 10 to 15 minutes, doing highlights, doing all this shampooing, all this stuff. And with time, it took a toll. So that's why I had my neck surgery. I had shoulder surgery. I had both wrist surgery in a matter of 2 years. So, and this one was supposed to be done, but for some reason they didn't want to approve this one. It's been quite a few years, so I don't remember. So I think it was left unfixed. And then with years of overworking it, whether it's cleaning or cutting hair more, even though I no longer worked in the salon after that, I would just cut hair for family and friends, and it's not that often at all. In fact, I haven't done any hair or makeup this year, just on my own self. My daughters kind of do each other because they know a lot of times my arm is in pain. But I kind of direct them. So yeah, so and then it says, it may also be autoimmune response. Risk factors including being over age 40, that's me, I'm 52, or having diabetes, no. Heart disease, no. Lung disease, no. Overactive thyroid, no. but I have arthritis. I don't know if that's included. The diagnosis is made by physical exam and an x-ray of the shoulder joint. Sometimes an MRI is done to look for other causes. Mild cases may be treated with home exercise program, anti-inflammatory medicines, which they gave me naproxen, which is kind of like an ibuprofen. But I've been taking ibuprofen, not like I'm supposed to, because I don't like taking medications. If in the moment I'm not having pain, why take it? I wait till I can't take it anymore, and I take it because I never want to get addicted. I never want to get used to anything being in control of me. So I'm very cautious of that. And if I absolutely have to do it as directed because it means fixing something or going worse, I will follow directions. But if it's just something regularly, like ibuprofen, you know, I take it unless I absolutely have to. Maybe I should have been taking it more because the pain is all day, every day. And maybe I should have gone back to taking it as directed, but I was taking it every night. I also do Flexeril, but Flexeril is a muscle spasm, a muscle relaxant, so nothing was helping. But they gave me naproxen, 375 milligram, but just for 5 days. So I'm thinking it was for the pain in my eye and more so for the pain in my shoulder, and then the Afrin would help the sinuses and stuff. So anti-inflammatory medicines, most severe cases require physical therapy. In some cases, steroid is shot. I've had steroid in my knees, but I have arthritis in my knees, or injected into the shoulder area. I used to have it in here before they did surgery. In hard-to-treat cases, forced movement of the shoulder is done while you are asleep under general anesthesia. This will break up scar tissue and increase your range of motion. Rare cases, surgery may be needed to remove the scar tissue. Over time, most people with frozen shoulder get back nearly all range of motion without pain. Recover may take a few months up to a year. You may still feel some stiffiness. And then it goes on to talk about physical therapy. So that's the result of where my eye pain was coming from and why I'm sick and what's happening in my shoulder. So I hope this video is not too long, because I don't know, I did it in segments, but you know, we edited it and put it all together. So it might be a little long, but just bear with me. I just wanted to share what I'm going through and take you on my health journey with me. So if somebody you know or yourself has similar symptoms or signs or is going through something, you can see what specialists and doctors have said for me, and see if that any of what they're saying helps, or what, you know, they're giving me, like I read what causes it and what it could be and all this stuff and how to take care of it. But definitely go see your doctor, because everybody's different, and what works for me may not work for you, but at least you have an idea what a specialist has said, what a regular doctor has said. And I've been to everywhere, and so this is from a doctor, and I have it on paper as well. But as always, consult your doctor first, because everybody is different. What works for me may not work for you, but this will at least help you get some idea of what could be happening and what you should do. Like me, I made an appointment for the doctor. I was taken to the ER. Your doctor appointment might be sufficient, or you might get sent to the ER like me, or you might get sent directly to the specialist. But now you have an idea from somebody who's gone through it and has sought medical attention. So what I'm telling you is from the doctor, from exams that were done on me, and from what I'm feeling, my personal feelings, and stuff like that. So it's not just my idea what I think it is. It's a proven fact, because I've been through everything that you're supposed to go through. But still, always consult your physician, because like I say, everybody is different. It might be something a little bit more serious for you. It might be something milder than me. They might take you down a different route depending on your personal exam. So always consult your physician. But if you see these signs, if you're feeling what I'm going through, or going through what I'm going through, or have the same symptoms or the same signs, definitely, now that you know what I went through and what it could be, and you know what doctors I saw and stuff, call your doctor, consult your doctor, and say, you know, I'm feeling this and I need to be checked out, you know, and stuff like that. And you can even say, I saw a YouTube where this girl went through similar stuff of what I'm feeling now, and she got checked out thoroughly, and so I want to do the same. So enough of that. I want to try to end this vlog, but I wanted to show you how I've been doing my smoothies lately. I gotta blow my nose. So I'm gonna step to the side because it's so gross. But I'm going to show you because I was talking about it the other day. I shouldn't really be drinking this smoothie because it has milk in it. But I'm okay because milk causes more mucus, more phlegm. And it's supposed to be juice and water, hot liquid, soup, tea, which I'm also doing that. But I really want to eat something healthy. And so it has almond milk, and almond milk is better than regular milk. And I'm only going to do one, which most of the time I do one. If I don't have two regular meals, then I'll replace one of those meals with a second smoothie. But lately it's been one smoothie. I'll eat my healthy breakfast like I did this morning. I ate my scrambled eggs with vegetables, and then I had my cup of oatmeal, and then my one toast with almond butter, and my cup of powdered cappuccino. And then now I'm going to do a smoothie, and then for dinner I'm going to eat soup because I need to get better and I can't eat regular food. So I'm going to eat soup. That's going to be for dinner. So that's going to help my body. And then probably before I go to bed, I'll have a lemon ginger tea, which I've been taking lately because lemon is good for you. So is ginger. It's probiotic, all that good stuff. So yes. So since I'm doing a smoothie, I wanted to show you. I have this one. My husband got me the Nutri Ninja. So if you're doing big amounts of stuff, like when I do the Puerto Rican coquito, or I'm doing smoothie for more than just me, like me and my daughter together, I'll use this one because it's bigger. But other than that, if I'm doing it for me, I have two other different sizes. My daughter likes this size. I like this size. This one goes up to 24 ounce. Oh my God. This one goes up to 32 ounce, the one that I like. So in here, I'm going to put a cup of almond milk. I should have got all that ready. And where is it? Okay. So I should have got this prepared first. So I use almond milk because I'm on a healthy weight loss journey. Almond milk, I love it. I don't taste the difference. So I do 1 cup of almond milk. So this is 1 cup. Where's my cup? Oh my God, it's right in my face. So I'll put 1 cup of almond milk. Then I'll take the 1/3 cup, measuring cup, and I do mixed berries. So this is the mixed berries I get. I get it at Grocery Outlet. It's like $3.99. It's by Northwest Select. It's mixed berries. So I'll take a 1/3 cup of mixed berries. Come on, get in there. It actually makes the smoothie turn purple. So it looks like that. Uh-oh. Oh my God! Hold up. Sorry. I spilled, I knocked my thing down and some of it spilt. So I had to clean it up, add a little bit more of what I considered spilt. So yeah, so I do the 1 cup of almond milk. Actually, I'm supposed to put my Slim Fast powder, this is what I use, the French vanilla, the only flavor, the only kind of weight loss powder that I use. But I went ahead and put the 1/3 cup of berries in first. So I actually take 2 scoops of this. You can do 1 scoop or you can do 2 scoops. For me, it works better. 1.5 scoops to 2 scoops. So the scoops are like this. On here it says 1 scoop. So to every 8 ounce. So since this is 36 ounce, I could actually use 3 scoops, but that's too much. 1 scoop is not enough, but 2 scoops is perfect. 3 scoops is too much. My daughter uses a smaller one. And I think she uses a scoop or 2. I'm not sure. But she would be okay using 2 scoops because it's 24 ounce and it's a scoop for every 8 ounce. So she would still be perfectly ready. Like I said, I would be able to use 8 times 5 is 40, 8 times 4 is 32. So you could actually use, if it's a scoop per 8 ounce, you could actually use 4 scoops. That's way too much. Like I said, for some people, even with this amount, can use 1 scoop. But definitely if you're using this amount, for me, 2 scoops. 1 is not enough. 2 is perfect. More than that is too much. And like I said, for my daughter, she could very well use like 3 scoops, but I think she uses 1 to 2, maybe 2. So we still are in perfect measurement of it. It just gives it better consistency to do just more than 1. If you're just doing an 8 ounce, definitely, like some people just do the glass. They have a really small smoothie blender thing. Definitely don't use more than 1. So 1 cup of almond milk, a 1/3 cup of berries, 2 scoops of Slim Fast powder, or you can use any weight loss powder that you want. Some people do the Herbalife, some people do other stuff. There's many out there. Slim Fast, the French vanilla is perfect. It has worked to lose weight, and that's the only flavor that I really like. When I was doing Herbalife, I did the banana caramel, but they kept taking it away, bringing it back, taking it away. It just, Herbalife is not for me. A lot of people like it, and bless them. It's not for me. But if you ever do try Herbalife, I do recommend the banana caramel. It is amazing. And I think 1 scoop is enough. But I haven't done it in a long time, so I don't even know if they still carry the banana caramel. You can check into it. I love bananas, love caramel, so that's the only one that I loved, and it was perfect for me. Herbalife works for a lot of people. My daughter does Herbalife. She loves it. Especially they have this tea that tastes so good, and it really helped her to lose a lot of weight. So Herbalife is perfect for her. It's expensive, so that doesn't work for me. Plus, this flavor and this powder, I noticed worked better for me than the Herbalife. Just that I really enjoyed that banana caramel. That's about it. And I thought their tea, when I tasted it for my daughter, I thought it was great. But that's it. But Slim Fast is my number 1. So again, 1 cup of almond milk, 1/3 cup of mixed berries, or you could do 1/3 cup of any of your favorite fruit. Just strawberries, mango, peaches, pineapple. I've tried them too, but I tend to really like the berries. 2 scoops of Slim Fast French vanilla, or whatever powder and flavor you like. 1 to 2 scoops, I'll say that. And then I'm going to do 1/3 cup of oatmeal. Oatmeal is so good. Let me tell you, I love oatmeal. I love anything that's cream of wheat, cornmeal. We call it funche, which is cornmeal mush. I love all that stuff, but definitely oatmeal is my number 1 favorite. In the morning, when I tell you I eat my healthy breakfast, I have 1 cup of hot oatmeal. I put in a cup of milk, a 1/2 cup of oatmeal, add my Trivia sugar or raw organic honey. Perfect. Goes with my scrambled eggs and my toast and my cappuccino. Perfect. Definitely included my smoothies. And let me tell you what is so good. Oatmeal is good for so many reasons. But if you have cholesterol, everybody will tell you oatmeal is good to lower cholesterol. And it's a proven fact, because cholesterol is hard to lower. You really have to be on your A game. You really have to be eating healthy and working out and really doing things by the book. And I had heard, and I was on medication for a while. And once I heard about oatmeal, I started doing oatmeal. They took the medication away from me. And my doctor personally called me to say, I don't know what you're doing, but keep doing what you're doing, because you have lowered your cholesterol. And every 6 months he checks me out, and I just got checked out, and he said, your cholesterol is great. You still have high cholesterol, but it's not high enough to be on any type of medication, and you are just continually lowering it, and I'm so proud of you. What are you doing? I said, oatmeal. He said, oatmeal is fantastic. So keep doing that. I said, I eat it for breakfast, and I put in my smoothie. So we'll put 1/3 cup of oatmeal in my smoothie. You could do less. You could do a 1/4 cup if you're not really a fan of oatmeal. Start off with a 1/4 cup and see how you like it. Or start off with 1 spoon, 1 basic eating spoon. Go from there, and then do, if you like it, say, hey, I can handle this. Then do a 1/4 cup, and then go from there. I wouldn't do more than a 1/3 cup. I think at the most I would probably go up to 1/2 cup, because I think that's enough for the amount of smoothie I'm making. Also, what I use is chai seeds, but I don't have any more. I just ran out. I was hoping that I still had the empty package to show you. Any chai seeds, you could get it at Big Lots, grocery outlet, Walmart. And some people like flaxseed better. Both are great. So whatever is your cup of tea, whatever you like better, get it. either flaxseed or chia seeds. I tend to like chia seeds better. And so if I had chia seeds, I would have put 1 spoon of chia seed in here. But I don't have anything, so that's going to be missing. So 1 big tablespoon of chia seeds, or even a cup, like a small cup. I don't know, like a quarter cup. No, I wouldn't say a quarter cup. Maybe 2 tablespoons at the most. But definitely at least 1 tablespoon, which would be like, to me, a tablespoon is like this size, a regular eating tablespoon. So about this size. If you want to put more, I wouldn't put more than 2, probably. So, but if you're into chia seeds and you want to put more, try it. See, and if the worst comes worst, you go back to 1. But that's the spoon I use to put in my chia seeds. So then after that, I put banana. Have to have a banana. Banana are my favorite fruits. But as they say, banana has a lot of sugar in it, or I don't understand that, but there's some fruits that have more sugar than others, or more sweetener. I don't know how you really call that, but you have to be careful not to eat too much of certain fruits. Banana's one. Bananas also cause constipation, but banana also has a lot of good to it. So you just have to outweigh the good and the bad. And the way to outweigh is not to take it directly out, because we need bananas. Bananas does have a lot of good. Is to just eat less of it. So I do suffer from constipation since I had my first child. And the doctor told me don't eat bananas. And I love bananas, and I kept eating and I didn't learn my lesson. But I love bananas, so I always have to have bananas. But yeah. So I do 1 to 2 bananas. Depending on the bananas. The bananas have to be really ripe. My husband got these. Where did he get these at? Food Max. They looked ripe, but they're kind of weird. They're not the perfect ripe, but they're okay. I like to go to Rady's because when the bananas start to get ripe, they put them in white bags and they lower them to 49 cents a pound versus 79 cents a pound. So they put in white bags, and I stack up 3 to 4 bags. Because we're doing smoothies every day, and not only me, my daughter does it. So they don't last too long to go really bad. So, but I like them to be ripe. So this one's okay. They didn't have any that day. So I just take it, and I cut it here. Just cut it in small chunks. It's trying to fall out of the thing. I don't know if you can see that. So just like that. This is a pretty big size banana, so 1 banana is good enough. If it's a small banana, I would go ahead and use 1.5 banana to 2 at the most. Don't use more than 2. A lot of people will only use actually a half a banana from the freezer. The less you use, the healthier it is. The less, not the less healthy, but the less sugar it is. So, but I don't, that just works for me. I have to have at least 1 banana because I love the taste of banana. Plus, it's not going to kill me to do an extra half of a banana. Like they say, you should use a half a banana. It's not going to kill me to use another half because I'm only doing 1 smoothie a day. So it's not going to kill me. And if I didn't have berries and the only fruit that I have, then that's when I would use 2 because I don't have any other fruit. So I'm like, okay, another banana is going to make up for the berries or any other fruit that I don't have. So after that, you're going to put a few cubes of ice. I just put it to the top. Make sure my blender could still go in. So this is like half of an ice tray. And I'll try to put in the description bar my recipe. I also do other smoothies. I have, when my husband got me the Nutri Ninja as a gift, it came with a book on how to do tons and tons and tons of smoothies. So I'm still working on other smoothies. I used to put in this very same smoothie, I would put spinach, but I ran out of spinach. And I don't do it often because I started to do spinach too much and I noticed I kind of started getting sick. And so I would do spinach every now and then, but spinach is also good to put in here. It's good for you. But I will do it because I was doing it like doing 2 smoothies a day and I was doing a lot of spinach and I noticed my system wasn't feeling it. So it kind of scared me. But I definitely would try it with spinach. It tastes so good. It turns it green. But I can't close it, so we're going to work hard here. There we go. And so, yeah, sorry for the noise, but I want you to see the whole step of what I'm doing. So I do it for 30 seconds. Shake it up. Still nice. Kind of got stuck. So I have to, this is what I should have done in the beginning. I usually shake it up and down, front and backwards to get all the ingredients to mix up. And then I'll put it in for another 30 minutes. Now it's good to go. Then I'll see if it has enough ice. Sorry for the noise. I just really wanted you to see me do it. So it's hasn't had enough ice. I like it thick. So I'm gonna put a few more cubes of ice. That's it. So that will kind of make a complete ice tray. So I just added like 4 more. So here we go again. Okay, let's see if that's enough. Okay, too thick, but that's good. I like it thick. Let me see if it's not too thick. Yeah, it's perfect. So I'll just stir it around a little bit. If I overly make it thick, what I'll do is add a tiny bit more milk. So, but I'm not gonna do that because I think it's fine. Then I'll put my top. And I'll taste it and show you what I think. And I use one of my straws that I buy that are bendable. I like these too, but I kind of like the ones that are bendable because none of them, that one's bigger and longer, but it still goes down. This one I like because they bend. So even though it's shorter, it stops it because I bend it. And if I'm sitting down, I could drink it better. Oh my God. So good. A little thick, so you see me sucking. A little bit more. I might put a little bit more milk. Just to unthicken it, just a tad bit. Oh, Jesus. Why do they make it so hard? So, I did make it. I should have just put 2 more cubes. So just like like that. It's like a tad bit. Just to unthicken it. Okay, let me see if that helped a little bit. It's still thick, but that's okay. I'm going to leave it like that because I don't want to add more ingredients than I normally do. I want it to be completely true to what I do. So every blue moon that'll happen. If I put a little bit too much ice, I have to put a tad bit more milk just to get it kind of more liquidy. But most of the time, I put just the perfect amount of ingredients. So I'll try to leave in the description bar. I notice that every time I leave in the description bar, it gives me a hard time uploading. So I'm going to try to put in the description bar, but if I don't, just write it down as you're seeing the video, if you like the way I do it. And I know some people will try to say, you shouldn't put that much. This is what works for me. I've done it for a long time. I told the doctor what exactly I do. He said, perfect. So everybody's different. If you're on a way stricter diet and you don't want some of this stuff in here, don't put it. Get the weight loss powder that works best for you, that tastes the best for you. Slim Fast might not be your thing. French vanilla might not be your flavor. Like I said, you might be a Herbalife type of person. You might be another type of brand, another type of flavor. This is just what works for me and what I love. So it's just an example. So you use the powder that you like. Almond milk is way healthier than regular milk. It's recommended by doctors and a lot of weight loss people. But if you're not into almond milk and you want to go ahead and still use your regular milk, do your thing. I wouldn't recommend more than a cup, but do your thing. I mean, it's not going to completely kill you or hurt you. Just as some things are better than others, and we just have to make our choices depending on what our specific weight loss journey is. If you don't like berries, don't use berries. If you like mangoes and pineapples and peaches and just regular strawberries by themselves, by all means do it. I used to do strawberries by itself. Then when I was meal prepping, I bought bags of mango and pineapple, or I would buy a bag of pineapple, a bag of mango. I tried peaches. I did just strawberries by itself. And I was doing that for a long time until I figured the mixed berries had the different berries. So I was getting more for, just do it singly. I was getting more. So berries ended up working for me. But every now and then I'll go back and do something different because I don't want the same exact smoothie forever. So every now and then I'll go back and just do strawberries, or just do pineapple, or just do mangoes, depending. And because that book has so many different smoothies, so many different ways, and it's really healthy, I could do a smoothie. But this is my basic smoothie that I've been doing that has worked for me for weight loss and for being healthy. So again, do whatever weight loss powder you want, whatever flavor you want. It doesn't have to be that. That's just what works for me. Use whatever milk you want. Of course, almond milk is better and healthier. If you don't like bananas, don't put bananas. I love bananas. If you don't like berries, put whatever your favorite fruit is. If you want to incorporate vegetables like some ginger or some spinach. Spinach works great. I tried it. I love it. Any type of fruit that would go well with it. There's so many recipes. If you look on YouTube, you can find, or Pinterest, oh my God, you can find tons of different smoothies that go for different reasons, whether it's weight loss, or just for being healthy, or just normal smoothies, or just really strict smoothies, or all vegetable smoothies, or all fruit smoothies, or cappuccino smoothies. You can find everything. Go Pinterest, YouTube is my high recommendations. I have the NutriBlend book. See if I have it here where I can show you. This came with my NutriBlend, and it's Simply Delicious, Simply Nutritious, Nutri-Ninja blender system, and it's 75 plus recipes. So if you buy one of these NutriBlender, my husband got it for me at Kohl's. It was $100 and something on sale. It will come with this book, and it will give you every idea and every recipe for healthy weight loss, just regular delicious smoothies. So that's one way to get it. Other than that, go to Pinterest and go to YouTube. You can find thousands of smoothie recipes for whatever reason you're doing it for, whether it's weight loss or just being healthy or for any specific reason. Again, if you don't like chia seeds but you like flex seeds, use the one that you like. If you like them both, I'll alternate them. Or if you don't like it at all, don't use it. It has a lot of antioxidants and a lot of nutrients and stuff. I wish I had my chia seed bags to show you what it purposes it serves, what it comes with. What else do I put in here? You don't like oatmeal? You don't have to add oatmeal. I add oatmeal because I've always, since I was a little kid, loved oatmeal. And then when I heard that it could help cholesterol, and I proved that it did, and the doctors support me, and I proved it that I constantly lowered it. It took me off of medication. It lowered my cholesterol twice already. And so, believe me, if you can eat healthier better than doing medication, medication is not good. I mean, if you have it so high that you absolutely have to be on medication, please consult your doctor and follow his orders. But if you can eat healthy and be without medication, that is so much better, because the medication can be really hard. So, but as always, I'm not a doctor. My first top advice, consult your own doctor. Everybody's different. Let them know what your goals you have, what troubles you're having, what signs, symptoms. I want to lose weight, I have cholesterol, whatever it is you're going through, let him know. Let him do the test, or her, if your doctor's a woman, her do the test, and say, hey, what do you think about oatmeal? I heard on YouTube, I heard it from 2 different countries and a lot of people. I heard that oatmeal is good for cholesterol. What do you think? And it's up to your doctor on how he feels. So you can make smoothie out of whatever you want. This is just the smoothie I've done for a long time now, and that's worked for me for being healthy and for losing weight. So I just wanted to share with you how I do this one particular smoothie. I do have other recipes that, as I do them, I will share those with you as well. It tastes delicious. Oh my God. So good. Okay, I'm going to go because this blog is probably an hour long. I sure hope not. But I hope you enjoyed it. I hope you just bear with me on what I was going through health-wise, the whole process of it, and how I do my smoothie, one of my smoothies, and all that good stuff. Like I said, I'm going to try to put up at least one video every day, especially because it's Blocksember. So I'm going to start working on another one tonight, but this is it for now. This would have been day 3 or day 4. It should be day 4 because today is 5th. So I should have had one up. But if I'm behind by one video, please bear with me. I will definitely catch up with you. So until my next video, thanks so much for watching. Please like this video just to show me your support. Even if you don't agree with everything, but just you support my journey and what works for me. Don't forget to subscribe if you haven't already. And push the notification bell because it gives you heads up on every time I upload a video. I really need your support. I don't have that many subscribers. I know a lot of people watch my videos, but I don't have, and not a lot. For me, it's a lot because I'm so grateful. And sometimes I'm like, oh, wow, that many people watch. It makes me feel good. So if you subscribe to my channel, that would really help. I don't make money from YouTube. I do this because it's my passion, because I love sharing my life, my family, my health journey with you, my weight loss journey with you, events, holidays, themes, causes, everything with you. And of course, I'll continue to do beauties, which what I started with. That'll also always be included. Hauls, reviews, all that good stuff. I haven't did a tag, like a question and answer. So, hey, I haven't done one of those in a long time. They call it tags, where some YouTuber would tag you, or you would put questions up, or you would tell people on your Instagram or YouTube, if you have any questions that you would like to know about me, let me know, and I'll answer them in a Q&A. Q&A is what it's called. But like I said, I still have a lot of content coming up. I still have every intention of doing my life series. I did a 4-part marriage. I really want to get in my next topic, which is infidelity. I still want to do my series on Jenny Rivera and her family. I think I'm going to start once a week, my thoughts type of video, where there may be things that are happening in life or in the news that, I'm following, and that I really have a thought or my feelings or opinion about it that I like to share with you, like everyone else does. Right now, I'm following the Chris Watts family murder. That's, if you haven't heard of it, he murdered his pregnant wife and his 2 daughters, a 3-year-old and a 4 or 5-year-old. And it's been all over the news. He was sentenced to 3 consecutive life sentences and 2 concurrent life sentences. He confessed to the murders. Horrid just to think that a father could kill any human being, his wife with his pregnant baby, and they were going to have a son for the first time. But to kill his blood, his two little precious girls, it just boggles my mind. I mean, you have to be a psycho or a sociopath, whatever they call him. You have to just have no soul. I mean, if you don't want to be married, which he didn't want to be married anymore, and he was having an affair, and he just didn't want, they say he didn't want to do the child support, all that stuff. I'll go into the video, but just leave. It's never worth killing a human being unless they're coming to kill you and you are saving your own life or saving your family's life, because they're going to kill you, so it's your defense. And if that's the only choice you have as a self-defense, somebody's breaking in your house about to kill you. But to kill any human being is just wrong, especially for his reasons. So if people are not happy, please walk out. And to kill your own children, I don't understand that. There's a lot of cases. We have the Scott Peterson case that I followed. I followed the O.J. Simpson case. He didn't kill his children, but you know how that all happened. So I'll probably be sharing my thoughts on that, even though that was way back. I'll probably give you a little thoughts on how I felt about the Scott Peterson case. But right now, I've been watching tons and tons of video of the Chris Watts. My heart just goes out to her. I watched her videos, and I love her. And just she shared her family and her love for life. And it's just been really interesting. I don't see every crazy murder case. The only three I have seen has been this Chris Watts, Scott Peterson, and the O.J. Simpson back then. I don't really try to get into it. I just really pray for the victims' families. I really pray for the whole situation. But I just don't get into it. I don't, try to involve myself at all. But there's certain cases that really touch my heartstrings, and this one was one of them. So I'm thinking of doing a video on my thoughts. I don't know these families. I don't know these people. I'm just going by what I have followed in the news, all the videos that I watch. And it's just my thoughts, my opinions. They're not evidence. They're not proof. The case is over with. All that's on YouTube for you to see if you want to see it from the district attorney's perspective, from the police perspective. All that's on YouTube. I just want to share my thoughts on what I think about it. And there's a part of the reason why it intrigued me, because there's a part that I can relate to that I've gone through. Like, I don't really want to get into the story, but not everybody is guilty as people think. Like the mistress, I do think in this case there's some unanswered questions and something funny, some things that are missing that are not good. Amber Fry, when it was Scott Peterson, I totally believed her and stuff. But sometimes when people are seeing each other, they really don't know that the person is married. They find out later. And it's how you handle it when you find out that's important, because you're innocent, because you don't know that they're married. In this case, she knew he was married, but she believed he was being separated, if she's telling the truth. But I had that same situation where something similar happened to me. Of course, nothing about murder or killing or hurting or purposely having an affair. I wasn't the one having the affair, but I have a story that I'll tell you my story and why I think what I think of this case. Let's put it that way. So look forward to that. Anyway, I gotta go. This video is totally long. Thank you for watching it. Please give it a thumbs up. Don't forget to subscribe, hit the notification bell, all that good stuff, and I'll see you on the next vlog. Take care.